Breaking news tonight, violence in the heart of Washington, D.C.
He started to lunge toward U.S. Capitol Police.
The attack, the victim, and the suspect. Also on this Friday, rethinking Canada's vaccine strategy, calls to immunize essential workers in places where the virus is spreading fast. Plus, what are Canadians who had at least one vaccine dose now allowed to do? Broadening the color of autism.
There was a lot of falling through the gaps.
The lack of help for parents with racialized children who are on the spectrum. And, oh dear, a rude awakening for a sleeping student on this school bus.
Global National with Donna Friesen.
Good evening and thanks for joining us. As we enter another holiday weekend, still stuck in the pandemic, there are reminders not to gather with people outside your household. The third wave, fueled by new variants, means case counts keep rising in many parts of this country, and younger people are getting sick. Today, Quebec reported more than 1,300 new cases there, the highest number since January. The majority of the cases are believed to be variants of concern. That province's Public Health Institute says more than 57% of tests screened for variants over the past week have turned out positive. Tighter restrictions are in place in Quebec and in BC, and they begin province-wide in Ontario tonight. Vaccinations are picking up, but not as fast as the variants are spreading. And though the age-based strategy to vaccinate older Canadians first has protected many of them, thousands of younger working-age people who can't stay home when there's a lockdown are now getting sick. That's led to calls to rethink the vaccine strategy. Travis Dhanraj has our top story tonight.
At this poultry processing facility in Lethbridge, Alberta, an outbreak last month led to more than 70 workers testing positive. In Brampton, Ontario, an Amazon warehouse saw 600 positive cases weeks ago. ICU numbers in Ontario are hitting record highs, many in hospital, essential workers.
You need to make sure that it gets where it's going to have the biggest impact.
Right now, the government booking portal only allows those 70 and over to make an appointment. In a push to move faster, some hospitals have lowered that age to begin immunizing people in high-risk communities 50 and over.
In Ontario, one of the biggest drivers that we haven't addressed is the occupational to household transmission chain and other congregate living settings.
More than 20% of community-based deaths in Ontario have occurred in just 10% of hotspots where COVID-19 rates are highest. The areas include communities in Windsor, Hamilton, Ottawa, and Peel, and have higher rates of death, hospitalization, and transmission. Toronto is targeting specific area codes identified as hot zones to ramp up immunizations, using neighborhood data on infection rates and case numbers as a guide.
This is one of those areas, Toronto's Regent Park, a diverse, densely populated community where many work in essential jobs and don't have the privilege of working from home during a lockdown.
Essential worker, we cannot work at home. It is not possible. But we are less than 55 years old. But everybody should be vaccinated. In our company, 4 or 5 people COVID positive.
City Councillor Joe Cressy, who is the chair of Toronto's Board of Health, says expanding the age range of those eligible in hotspots is only the first step.
Getting people to those clinics, bringing those clinics to people, that's how we're going to achieve herd immunity.
It's why the city has launched a mobile immunization campaign. The province is working on something similar, but points to vaccine supply as a problem. One more challenge to conquer during the third wave. Travis Dhanraj, Global News, Toronto.
The federal government promises more than 1 million vaccine doses are expected to arrive in Canada each week in the coming months. At this point, more than 5.9 million doses have been administered across the country. Nearly 14% of the population has received at least one dose. Vaccines offer the path out of the pandemic. And today, the American Centers for Disease Control issued travel guidelines for Americans who are fully vaccinated. They can travel domestically and internationally without having to show a negative COVID-19 test or quarantining, unless the country they are entering requires it. The CDC still recommends people wear masks and follow public health precautions. Here in Canada, there are no guidelines yet for those who are vaccinated. Abigail Bimman reports.
We're waiting until we can get back to the coffee shops.
These Vancouver seniors are thrilled to get their first vaccine, but they know it won't change very much.
Definitely won't relax about it.
I'm kind of writing off 2021.
You may breathe a sigh of relief after that first shot, but experts say don't breathe it on someone else.
We're still recommending that they wear a mask, they still practice good hand hygiene, and they still follow the public health guidance because we don't have enough of us vaccinated yet.
And with COVID-19 vaccines so new, more data is needed about protection and spread.
We don't know a lot about how much that protects other people from getting COVID from you or protects you from transmitting COVID. But the data on that is coming and it's looking very positive.
The U.S. Centers for Disease Control and Prevention issued updated guidance again Friday for what fully vaccinated people can do.
We state that fully vaccinated people can resume travel at low risk to themselves.
While the CDC still isn't recommending travel, experts say communication like that helps boost vaccine confidence.
I think if that messaging were to be incorporated here, a lot more people would be happier to start getting their vaccine so that we can eventually return to some sense of normalcy in Canada.
This country has seen no similar guidance.
Clear, transparent communication has been lacking throughout this pandemic.
Just try and make sense of this recent exchange on the topic in the House of Commons.
Planning on issuing any guidance on what vaccinated Canadians will or will not be able to do.
Unlike the party opposite, we do believe in science and evidence, including the evidence that climate change is real. I will also remind the opposite member that it is, in fact, work with provinces and territories that results in national guidance.
Is she planning on issuing, on the advice of her department, any guidance on what vaccinated Canadians can or can't do?
I am confident in is the safety of the vaccines that have been approved by Health Canada to save people's lives.
One big question the world tries to work out, will we need to show proof of vaccination to travel or to do certain things? In Ottawa, discussions are ongoing with G7 partners and within Cabinet about the question of a vaccine passport, both internationally and, sources say, more contentiously within Canada. Abigail Bimman, Global News, Ottawa.
Health Canada is advising Canadians not to use face masks that contain something called graphene or biographene. Graphene is a novel nanomaterial, a material made of tiny particles that is reported to have antiviral and antibacterial properties. Health Canada says inhaled graphene particles could pose a health risk. It is doing a scientific assessment and, as a precaution, is asking companies to stop selling masks that contain graphene and for people to stop using them. The highly contagious P1 variant, first detected in Brazil, that led to the closure of the Whistler Blackcomb ski resort in BC this week, appears to be spreading more rapidly in that province than anywhere else in Canada. BC reported 379 cases of the P1 variant on Thursday. BC's top doctor says it's led to more young people requiring hospitalization.
The numbers of younger people in hospital have gone up. And that means that the numbers, younger people are thankfully more likely to survive. So we know the length of stay is longer, and they more often are needing ICU care. So the percentage of younger people who are in ICU has gone up.
Research has shown the P1 variant is up to 2.5 times more transmissible, and though more research is needed, there's some evidence in Brazil that it can infect people who have been vaccinated and possibly reinfect people who have already recovered from COVID-19. Well, hockey is on hold for the Vancouver Canucks after 5 more players tested positive for COVID-19, placing more strain on the NHL season schedule. 7 players and 1 staff member are now in COVID-19 protocol, and that number could rise. The team may be allowed to practice again on Tuesday, and the next 3 games against the Edmonton Oilers and the Winnipeg Jets have been postponed. Under the NHL's guidelines, players and staff are required to take a COVID test every day. In Washington, D.C., another Capitol police officer has been killed in an attack in the heart of that city. A car rammed into a security barrier, killing 1 officer and injuring another. It happened just after 1 p.m. local time, on a day when no U.S. politicians were inside the Capitol. Congress is in recess right now. Jackson Proskow is near the scene tonight. Jackson, bring us up to speed on what we know, including about the suspect.
And Donna, they're actually just towing the car away from the scene right now as the investigation continues into what led up to this incident today. It plunged the Capitol complex into lockdown as this vehicle rammed a security checkpoint on the Senate side. The driver is identified as a 25-year-old. Again, motive is still unclear at this point. 2 Capitol police officers were struck. They opened fire and killed the suspect. But listen to how U.S. Capitol Police describe what sounds like it may have been a premeditated attack.
The suspect rammed his car into 2 of our officers and then hit the north barricade barrier. As such time, the suspect exited the vehicle with a knife in hand. Our officers then engaged that suspect. He did not respond to verbal commands.
1 police officer later died of his injuries, identified as William Billy Evans, an 18-year veteran of the U.S. Capitol Police. And understandably, this has been an incredibly traumatic year for U.S. Capitol Police. They have lost 4 of their officers, not only from today, but in the wake of the January 6th riots here on Capitol Hill. Donna, there is still an ongoing debate about long-term security measures here at the Capitol complex, but the barriers that were hit today have been in place for decades. Those are existing security measures. Still, an attack like this is incredibly traumatizing, both for those who work in and around the Capitol complex and, of course, the law enforcement officers who are charged with guarding it. Donna?
All right, Jackson Proskow in Washington, thanks. There's more turbulence tonight in the Canadian airline industry. Air Canada's plan to take over Air Transat has been called off. The company's announced they've given up on the $190 million deal, first initiated 2 years ago. Mike Armstrong explains what it means and where it leaves Air Transat.
The reason Air Canada tried to take over Air Transat may be the reason that's not happening. The goal was to grow and control more of the market. That's something the European Commission wouldn't let happen. Air Canada says it tried to meet the conditions the EC wanted to protect competition, but hit a limit. In a statement, the company says, quote, Air Canada has concluded that providing additional onerous remedies, which may still not secure an EC approval, would significantly compromise Air Canada's ability to compete internationally. Now, the Canadian government had already signed off on the deal. In announcing his approval in February, the transport minister said the devastating impact of COVID-19 on the airline industry was a key factor.
This would have created a much larger airline.
This airline industry analyst says getting approval from the EC likely would have meant giving up routes to Europe so as not to be too strong competing with other carriers. That would have been one hurdle too many for Air Canada.
If they had to shrink in order to complete this merger, it probably didn't make sense for Air Canada to do it.
Now, to pull out of the deal, Air Canada's had to make some concessions. It has to pay Air Transat a $12.5 million termination payment. It's also waiving a $10 million fee it would have been paid if Air Transat were to find a new buyer. There may be one out there. Quebec media mogul Pierre-Carl Pelleteau made his own offer for the company in December and is confirming it's still on the table. Air Transat said Friday it's considering pursuing those discussions. Now, the federal government is already saying it's in talks with Air Transat and focused on protecting jobs. There will also be pressure on the Quebec government to support the company. Its headquarters are in Montreal, but that may be slightly more delicate. Quebec's premier has some ties to the company.
About 30 years ago.
François Legault is one of its founders. Mike Armstrong, Global News, Montreal.
The head of the Minneapolis homicide unit on the witness stand. Coming up, what he testified about Derek Chauvin keeping his knee on George Floyd's neck. There was some tense testimony at the murder trial of former Minneapolis police officer Derek Chauvin today. A high-ranking officer called Chauvin's use of force on George Floyd last May totally unnecessary.
Pulling him down to the ground, face down, and putting your knee on a neck for that amount of time is just uncalled for. I saw no reason why the officers felt they were in danger, if that's what they felt, and that's what they would have to feel to be able to use that kind of force.
So, in your opinion, should that restraint have stopped once he was handcuffed and prone on the ground?
Absolutely.
Part of Chauvin's defense is that he was just doing what he was trained to do. The high-profile murder trial resumes on Monday. There are signs tonight of a possible return to talks on the Iran nuclear deal. Washington and Tehran have agreed to start indirect talks with other major world powers next week. This comes nearly 3 years after President Donald Trump pulled the U.S. out of the deal. President Biden has said rejoining the agreement is a priority for his administration. Negotiations are expected to be difficult. There are a number of issues to be discussed, including sanctions. So far, the U.S. and Iran are not expected to have any direct talks. Vaccinations and violence still ahead, the risks facing frontline workers in war zones. Terrible scenes in Taiwan after an express train with 500 people on board derailed in a tunnel. Some cars were ripped apart, others crumpled. At least 51 people are dead, including the driver, and more than 140 are injured. The train hit a truck that had rolled onto the tracks from a work site above. Some survivors escaped the wreck through the windows or through the roof. The crash happened at the start of a traditional long weekend holiday when people head home to tend to family graves. Aid workers in conflict zones always do dangerous work. They provide critical care while facing grave risks. Just this week, 3 women vaccinating children against polio were shot and killed in Afghanistan. As countries around the world prepare to roll out mass COVID-19 vaccinations, Crystal Gamansing looks at the risks to the people doing it.
The sight of a coffin in a conflict zone is not unusual, but it doesn't make it any easier to see. 2 separate shootings on Tuesday led to the deaths of 3 polio vaccination workers. International laws protect healthcare workers in conflict zones. Still, Jason Nickerson says the job can be dangerous.
If you're providing healthcare close to front lines, that is inherently risky in a way that working in a hospital in downtown Ottawa is just not.
Nickerson, who is in Ottawa right now, recently spent time in the Democratic Republic of Congo working to prevent the spread of Ebola. COVID-19 vaccinations are a part of the work being done by Doctors Without Borders in Lebanon.
Local ceasefires are going to be essential to enable life-saving vaccinations to take place.
Britain's Foreign Secretary successfully lobbied the UN Security Council to call on all nations engaged in conflicts to pause for humanitarian efforts. It's not that fear of COVID-19 vaccinations would increase the risk to workers, but rather an acknowledgement of their critical roles. 360,000 doses of COVID-19 vaccine recently arrived in Yemen, a country plagued by a multi-sided civil war that has raged for years.
If you see all the misery on the ground, if you see people underneath on the ground, you can understand why we're doing this work.
Bagwas Sedawan says risk management is a critical part of his work with Oxfam in Yemen, but he says people are the most important part to him.
You see how people are smiling, you see how people appreciating the support given.
Workers, regardless of their task or the logo on their backs, say the need is too great to focus on the risk. Crystal Gamansing, Global News, London.
Autism across cultures. Next, how race is impacting the care of children on the spectrum.
You're watching Global National.
The driver of this school bus didn't even have time to react. A deer smashed through the front windshield, landing on a student who was hunched over asleep in the front seat. It happened in Virginia. The 15-year-old in that seat said afterwards he was stunned and really confused, but he is okay, and so is the deer, which ran off when the bus driver opened the door. Today is World Autism Awareness Day. Raising a child with autism can be challenging and sometimes difficult. And as Mike Drolet explains, adding cultural differences into the mix can make it even harder for parents to find the support their kids need.
For Xavier Jackton, the first hints of autism became apparent at camp.
They said they can't handle him. I should come pick him up.
But it was when he started kindergarten that his mother Jane knew they needed help.
In his second week, he was suspended because he had bit one of his educators.
Xavier was 4 when he was diagnosed with autism, and when she sought help, she says they found a system that ignored multiculturalism. Eventually, she found a single session devoted to the Black community.
There was also a Punjabi session that I attended because they were talking about feelings of shame. And I said, I can relate to that.
Dr. Shivajan Savapalan says we can't ignore those cultural issues anymore. Indeed, language and culture were factors in a 2017 study that found Black children are 19% less likely than white children to be diagnosed with autism. Before Dr. Savapalan's autism clinic began operating a mobile service to marginalized communities, he would direct families to their pediatricians.
But then they would show up a year later still with the same issues, and I'm realizing there was a lot of, falling through the gaps.
Foundations like Camille Proctor's The Color of Autism aims to fix that by doing outreach programs into communities that are distrustful of authority and new to the idea autism doesn't see race.
Initially, the response was like, why are you trying to do something separate for separate people? This is segregation. And I'm like, it's really not.
Proctor, who is from Detroit, knows it's an uncomfortable topic, especially in the current political climate. Funding is also an issue, as it's always been with autism. But even if services aren't expanded in the U.S. and Canada, education programs can be.
So there's so many things that I think we all could do to make this world better. I'm just trying to do my little part.
Mike Troy, Global News, Toronto.
And that is Global National for this Friday. I'm Donna Friesen. If you've got children who can't wait for an Easter egg hunt, we want to show you some animals getting in early on the fun. Meerkats and monkeys at the London Zoo had their own Easter egg hunt today, each egg filled with their favorite treats. Thanks for watching. Robin Gill will be here at the Anchor Desk this weekend, and I will see you again next week. Take care of yourselves. Bye-bye.